The communicable disease of the day, as you're all aware, is Ebola viral disease. There are a lot of other disease threats in the world, but this one I know is top of mind. And I really want you to know just three things. One, the fire is in West Africa. That is where the epidemic is raging. Two, this disease does not transmit easily. In fact, it doesn't transmit easily at all, and I'll give you some examples of that in just a second. The third thing is that we're actively monitoring folks that are coming into the country that have a risk. Currently in Tennessee, we're monitoring 13 people. We've completed the 21-day monitoring on 11. Our neighbors around the country are also doing the same thing, and we're getting the information as to where folks are coming from the CDC through the entry airports. So again, fires in West Africa, primarily three countries where the epidemic is raging. You've probably heard this on the news: Sierra Leone, Guinea, and Liberia. Mali is probably going to go off that list soon. This list may change over time, so it pays to stay aware. But the risk is for 21 days after the last exposure. 21 days after the last exposure, hence the 21-day monitoring period. The transmission of Ebola is difficult relative to a lot of other diseases. Once transmitted, it can be a pretty scary disease, and it gets people's attention with a 70% mortality rate plus. But the fact is that when people aren't sick, if for example, the people that we're monitoring, they are not a risk to anybody. You have to have symptoms in order to transmit Ebola. Secondly, and very importantly from your standpoint, people are not very communicable early in the disease. In fact, it's difficult to detect virus when people first begin having symptoms. When they get much sicker, and typically at that point they're isolated and typically they're too sick to really move around, that's when the disease becomes much more transmissible. That is typically late in the course, as I said, when people are very sick and have quite a bit of nasty symptomatology, or they're deceased. So unlike many diseases, Ebola remains a very, very significant risk for an individual who is deceased. The third point, isolation and quarantine. We quarantine people not because they're sick, but because there's a risk that they could become so. And if they become so, they could be a risk to other people. Currently, all the people that we've been actively monitoring in our state have been very cooperative. Most have been very welcoming of our active monitoring. That consists of an in-person interview with people coming in, daily contact with public health staff, regular temperature taking, symptom assessment, and then when they complete the quarantine, we do a final follow-up visit with them. And there's different types of monitoring depending on the risk category that individuals go into. But as I said, to date, everybody in Tennessee has been very cooperative. We're fortunate to be in the volunteer state. Should they not be cooperative, remember I said the fires in West Africa, should they not be cooperative, if we don't know whether or not they could become, if you will, a glowing ember, to continue the analogy, if we can't keep up with them because they won't cooperate with us, then we have the power to issue a health directive, and if they don't follow that, we can very rapidly, within hours, back that up with a court order to quarantine them. Again, they wouldn't be sick in that case. If they're sick, we isolate them. There's a gray area sometimes between people who may have a risk, and we should know about them because as I said, those are getting reported to us or being actively monitored. And if they show up in a facility, then there's a gray area as to whether they're in need of isolation. We have a great deal of preparedness now in Tennessee to assess that. And for those people who are being actively monitored, we are in contact with the facilities in their areas and letting them know that they're there and that they may have to be assessed if they develop symptoms. So again, three things to remember: the fires in West Africa. Those are the countries that we're concerned about. So far, despite all you've heard, there have been 2 imported cases in the United States that developed when they arrived here. Mr. Duncan and the physician in New York, not counting the cases that came here deliberately for treatment. So 2 imported cases so far in the United States, and 2 healthcare workers impacted by those cases. The quick story on transmission. One gentleman in Liberia, sick, got on an airplane, went to Lagos, Nigeria, a teeming city. He died 4 days later. He had 894 contacts. There were more than 18,000 visits that the Nigerian government did to actively monitor his contacts. Of those, 19 fell ill. Nobody on the airplane got sick. He was infectious at that time. He was ill. He was well enough to get on an airplane, so he wasn't at his peak of infectivity. But again, lots of contact, no risk. Mr. Duncan, as many of you know, the gentleman who died in Dallas, had a lot of contacts. The only 2 people that actually got sick were 2 healthcare workers that were taking care of him in very close quarters and doing some very high-risk procedures. Not even the people that he was living with were sickened in that situation. So yes, there's a risk. Yes, it's manageable. It's possible that we might need your help at some point to do a quarantine. If that happens, we will certainly contact you. A health officer will be available to you as well as a small team, and there'll be a court order available to enforce that quarantine. Thank you for your attention. And I have a handout. It's a 1-pager that just reiterates what I just told you.